Comme souffrir.
On est quitté, comme on a crié. Ça a crié, ça a brûlé. On est quitté, la galère de là. On est quitté, tout le monde a souffert.
Comme souffrir.
On est quitté, comme on a crié. Ça a crié, ça a brûlé.
Bateau
Good evening, everyone. As you know, at this time, this is the time your show, Healthy Vision, come to you. Tonight, we don't have Lady Nay, but we have one of our guests that here is Dr. Basil. He will be discussing throughout the whole show. I know Dr. Basil is an epidemiologist, and he is one of my classmates, and there is a lot going on in December. Like we did or in all the previous months, like November was diabetic eye disease, December is safe toy and celebration months. What that means, a lot of people would say, why we, every month, but we don't make this thing up. It's because we are in the United States, most of the organizations that focus on prevention, like they do research, they see what's going on each month. That's why the American Academy of Ophthalmologists, the American Academy of Optometrists, you know, they consider this, they see based on the research, this is the month most of the kids has eye injury related to gift they get from their parent, from someone, somehow or out. That's why we focus on advise everyone. And whatever you're going to give any child, any form of gift, you know, give you some advice. Because roughly research prove 1 out of 10 of children eye injury that end up in the emergency room, most are caused by toy. And that's why in regard to this, in regard to this, for this month, we're going to talk about December. As you can see, we start showing like these kids, you know, and the type of gift this kid is playing. But guess what happened with these kids? And one of the gift is this kid is playing because there is no parent, nobody is watching at these kids, and anything can happen in the eye of this kid. We have more picture we are showing you. Like if you as you look at the next picture, these are the picture we're showing you. That's not advice. But I don't want to say to you, if your child want to have this type of gift, you're going to prevent them have them, but make sure they have some safety. They have some safety tool on them. There is more. We're going to ask our IT to keep showing them one after the other one. Because you see like this type of picture, this is all tool, all this picture you see that can damage the eye. Now, we have picture too, because in the Press Center for the Visually Impaired, we are not only we are not only see people that have good vision, we see people that doesn't have vision too. But there is a lot of gift for them too. We see people too that have vision, but vision is not as good. We see also kids that in a phase where they need to improve their vision. But there is special gift for them too. We're going to show you this type of gift. As you can look at this one, what do you see? You see this type of gift like this one? I know you can see a lot of this gift for those kids when you go to the store. A lot of those teachers, specialists use this to teach kids some specific skill to improve their brain, to improve their fine motor skills. But it's not only this, they can improve their vision too, because you see a lot of contrast, you see a lot of different color, because based on the age of the kids, there is some of the color that the kids, those color pop up easily. But for us at the Press Center, we use this type of tool to do, when we do for the kids what they call vision rehabilitation therapy or vision therapy. We use this type of picture. Now, we show you a few pictures, but we're going to show you when you get some of the gift that's not too good for the kids, what can happen for these kids. We're going to show you some of the picture before we come in with our guests. And as you can see, this is one of the kids that was playing with one of the gift. One of the one we showed you before. What happened? The toy the kids was using just popped inside the eye, and that's what happened with this kid. This kid end up in the emergency room. There is more than that. And throughout the show, we're going to discuss a little bit about this. But we don't want you to say we talk only for kids. We talk for adults too, because there is a lot of adults. that get gift, they get a laptop. They can get a tablet. As a lot of you that in the United States, a lot of you that watch Channel 7, you may see this week they were talking about using tablet or using computer, or that can damage the vision of some of the kids. They've been advised how many hours they should use. But you can see, I don't know how many of you who are watching the show now that been working on computers, at some point you feel your eye is hurting you, your eye is dry, you feel your eye is tired. But guess what? Did you ask yourself the question, even if you wear glasses, do you have blue light protection on it? If you don't, you will still feel this type of symptom. Now, we don't want you, because research proved in 2030, a lot of 4% of people will have vision issue related to the blue light, to the computer, to the cell phone. This is not just talk, this is fact. That's why you see a lot of our care specialists, when you go to see your eye doctor, I'm talking for you, this is the end of the year. If you go to see your eye doctor, make sure you advise your eye doctor. If you have your kids, please put blue light protection in the glasses for me. Even for you, don't take, they just say to you, they put transition, and that's okay. Transition doesn't mean sunglasses. Make sure you tell them, put blue light protection. Or if you don't know the word, put computer protection. Now, we are not going too deep. I'm going to slowly introduce you our guest tonight, which is Dr. Basil, and we're going to say to you, welcome to Healthy Vision.
Thank you, Dr. Prince, for having me tonight. It's a pleasure to be in the house tonight for this show with you. So last night I was here, I was talking about the World AIDS Day, and tonight again I'm here. We're gonna be talking about music, about the World AIDS Day, and also about people who are visually impaired.
Yes.
So, thank you.
As you can see, we're going to talk about a lot with Dr. Basil. He said we're going to talk about music, but don't think music is not related to low vision and blindness, because you're going to learn a lot about it. And first, before we go to the subject, I'm going to ask Dr. Basil, to a little bit talk about yourself. I don't want to present you to say who you are, stuff like that. When are you here?
All right. Thanks a lot, Dr. Prince. So, Junior Basil is a young gentleman who's from Haiti, who was born in Pétionville in Haiti, and who grew up there. And we went to med school in Port-au-Prince, Haiti. And then after med school, started working in the countryside of Haiti, addressing a lot of public health issues in the country with an organization called Zanmi La Santé, Partners in Health. So I worked there in the central plateau of Haiti, in particularly Bukankari and Belader, for 5 years. Then after that, I obtained a Fulbright scholarship to pursue a Master's of Public Health at the University of Alabama at Birmingham. Then after my master's, I went to Africa. I worked there for 5 years, particularly in Burundi and in Malawi. Then in 2014, came to the US, and that's where I am now. I did some work with the New York City Department of Health on a research project that was looking into the effect of the Zika virus infection on the central nervous system of children that were exposed to the virus. And I'm currently working now with New York harm reduction educators, and we are mainly working currently with people who use drugs and people who are involved in sex work. That means people who are at risk of contracting HIV and also hepatitis C infections. So I'm also a musician. I play a couple of instruments, and I am a recording artist. I have an album that currently is available, and I'm also moving forward with that concept that is music for health, which is, in my view, an efficient way to use music to do disease prevention, health promotion, and also use music to make people feel good.
Oh, that's good. But this is very impressive for me. For as my classmate, I'm very proud of you. But I know when we opened the press center in 2016, you were the opening. I was trying to grab you to go to Salis University, but for some reason you didn't want to go. but we can see with Dr. Basil, it's very impressive. And as far as you're talking about music for health, we're going to go straight to that subject because it's not too different because the way the country is going now, the way the world is going now, you know, music play a very important part as part of the healing aspect. Because even for us at the Press Center for the Vision and Blind Facility, we use music but we use music and dancing also as for a form of vision rehab therapy. Again, a lot of people may ask us, I'm going to ask you to talk more about it in your sphere, or that's going to work you because you said you work with the city, with the New York City Department, with people with drugs, stuff like that, or you can empower them to get back in life, to live where they are now and get a successful life. Now, I'm just give you an example, or we use it, you know, we are not savvy like you. We're glad to have you, but at the Press Center, what we do, we use music, music and dancing help us, you know, to do some correction, what we call posture. When we say posture, we have some people with visual impairment that lost the vision somehow. Sometimes you see them when they're walking, they'll walk to the side because they may lose one eye. They cannot see with the other eye. They don't want to walk straight because, or they have one eye they see better than the other one. They have a little, they try to adapt that way. But we do with dancing and music, and we make them do what they call eye and body coordination movement and correct that, easy them for them, let them use what we call in the vision field eccentric viewing, their sweet spot. A sweet spot is where the vision, the maximum is. We use that. But just to let you know, this is one of the aspects as we use. But as for you, for Music for Health, I know you write music, you play music. I will want, or whoever is listening to us now, they're going to see some of your music, but we wish we have some of your video too. Don't know. But so, yeah. What make you come with that Music for Health?
Okay, so you know, I have been playing music for a very, very long time. Since I was a child in Haiti, I was always interested in music. My dad detected that and then offered me the opportunity to play music by giving me my first guitar when I mean, it was not even a guitar, but it was like I would say, house-made guitar. So it was around when I was 3 or 4 years old. And since then, I've been enjoying playing music. I decided, I mean, I have been thinking of, you know, the power that music has on people's brain, on people's understanding of what exactly is happening around them. And I also was thinking, okay, you know what, when I was in kindergarten, when I was in elementary school in Haiti, for instance, whenever a teacher would want us to really understand and remember some lessons, then the teacher would make us sing that lesson, right? So we have so many examples of things that basically when we want to remember them, then we use music, we use song to remember them. And that way we are more likely to remember the song. By remembering the song, we're also more likely to use the message that is content into that song. So that same can apply for health education, because there are specific messages when we are talking about health education that we want people to be able to remember. And because when we know when they remember them, they are more likely to use those messages. If we are talking, for instance, about HIV, December 1st is World AIDS Day. Yeah, there are specific messages.
Well, we're coming to that. Yeah, let's stay in the music first.
And, you know, when we want people to remember those specific messages, then I strongly believe that one of the key ways that we can get that done is by making sure that people can be exposed to songs that can literally provide them with messages for disease prevention, for health education, for health promotion. And I think, not only in the area of health, but in other areas, right?
Yeah, but well, what you said make a lot of sense because I remember even when I was studying for medical board exam, there's one of the teacher, a doctor, that says the pathology, but I forget his name.
Yeah.
But
I know who you're talking about,
yes,
and I
but
have
he used,
interacted with
yeah,
them
he used music to teach us the
Exactly,
disease.
exactly.
It was easy to, not only to memorize them and to understand them as for fun.
Yeah.
But but this is a good way we're talking for the student. But when we're talking for people that sick, that have blood pressure, that have anxiety, and I'm taking the music approach also, even when people to go to the gym.
Yeah.
And me, I made that experience for myself. If I go to the gym, I'm just on the treadmill. It's different.
the music, right?
If I get the music, I can do 2-3 miles. I'm not like you. I'm not that so like you. I may do 2-3 miles without even know. But without the music, in less than 1 mile, I'm already tired.
Yeah, that's very clear. And the other thing that I also would like to briefly talk about is, I invite the viewers to just think about any significant moment in your life when you were either sad or celebrating something. Just try to think about any significant moment in your life that you spent without music. I'm thinking now, I cannot find any because music has been constantly in my life, and I think it's the same for everybody, not only musicians, but people in general. When you were born, your parents probably had a party, there was music.
Yeah.
For your first communion, there was certainly music. For your baptism, there was music.
But,
for your wedding,
there is music.
there will be or there's music.
But that's good. But that's a good project. I hope a lot of people in the medical field and the path Dr. Basil is taking as for Music for Health is a good way to support. It's not a project because everything is always, he's writing a lot of music. He has a lot of music coming out. We can't wait to have them, and we can have a big activity because at the Point Center for the Visually Impaired, we use music. Even for kids, we may have those kids that came to the Point Center with low vision or with blindness, and some of their parents think they don't have some social skill. We use music and help them. We may just give them, I'm just giving you one example. We have some of the instrument, we give it to them without telling them what it is and let them figure it out. That helps them do what the skill called problem solving. This is we use them to help them improve even when they have this. So even music, we use it also when we teach people that completely blind. When we teach them what they call orientation mobility, or when we try to get their auditory skill, we make them go to look at where the music is. You put the music, look at the sources, where it is, And some of them even give us their own music, because I remember when I was at the VA in Connecticut, some of the veterans, and we ask them to come with something they like, they come with their own music. And for the whole training, they want to have their own music. That's why we can see even a unhealthy vision. There is one music I like. That doesn't mean most likely I'm waiting for your music, Monsieur Président. That one, I see it on YouTube, but I wish a viewer can see. I don't know if for IT, because I saw IT showing you some of the picture now as for some of the kids or some of the people that lost their vision, or the musician, or with music, with instrument, you don't have to, whether you have vision or not, this is a way, everybody use it for something, because me, I feel like if I did know how to play music, maybe I would not have blood pressure now. Maybe. Yes, you should that, but sometimes you may say you're too old for that.
But one very brief comment that I have regarding the kids that you talk about in regards to music. Besides the aspect of music for health, like educating people, there's also another aspect that I'm very, very interested in, which is how to use music to expose children actually to music at early age and the capability that music has to significantly increase their intellectual quotient and also help them concentrate better at school. A child who is capable to have better concentration at school is more likely to be successful at school. So there have been so many research papers published actually on that particular topic, the inability that music has to help children concentrate more at school and increase significantly their intellectual quotient. So that's another aspect of, I would say global music for health that I'm thinking of. And then the last one is it's related basically to I would say at the neurologic level, the capability that music has to make people feel better, to make people feel good. And there have been some research studies also conducted by particularly one guy that is really into this. His name is Daniel J. Levitin. He published a book a couple of years ago. The title of the book is Your Brain on Music. This is Your Brain on Music. And he was looking in his lab by conducting some experiments on the effect of music on the brain. After putting those probes on the skull, when playing that type of music, how do people react based on what he's seeing, the reaction of the brain? When you play that other type of music, how do people react? When you play a song in a minor chord, how do people react? People tend to be sad. People tend to react sadly to music in minor chord because minor chord make them feel sad. So those also other aspects of the power of music on the brain and how music can significantly bring changes to people.
Well, that's it. What you said that's very true, because even I have my little son now, he's 2 years old. Guess what? He's learning all the alphabet, all the color to music.
Exactly.
Because I learned all the music than Dave and Eva, because most of the toy for those little kids that just born, you see, they all have music and learning music. That means the challenge is even higher for you, because we are in a country where excellence is the key, and I know you're smart, but before we go to the next subject, because December 1st was National HIV Days. All the HIV affect the eye and different part of the body. We have an epidemiologist here, Dr. Basil, and that's the best person that's going to talk to us about it. But before we get to the next subject, we're going to take a quick break with one of the Dr. Basil's music. I don't know if he's ready, because what we're going to, okay, and if he's not ready, but we want to see it. A lot of people that's watching the show would love to see Dr. Basil's music, and hopefully, like I said to you, the music I like, you don't have it here, but I hope everybody likes this one. Okay, we're going to take a break. We will be back.
Des gens qu'ils voient mourir. N'a pas cherché quotidien sortir, mais nous connaissons aucune guérison pour lui. Même si la science pile j'ai fort qu'à faire, nous prenons responsabilité, nous tête frère. Oh, oh, yeah. Est-ce que nous avons combien frères qui allé? Est-ce que ça parie ou rien amis? Est-ce que nous compter combien frères qui a vivre? C'est quoi yo seulement là que nous? Grand plaisir avec capote, si spon marcher chercher l'ancien. Yon mari pour yon madame pour yon mari. Grand plaisir avec capote, si spon marcher chercher l'ancien. Courage et malade, yo chaque jour prend médicament yo zami moi. Respecter qui gagne un sida. C'est mon même genre à nous. Yo gen droit pour y aller à l'école, yo gen droit pour y travail. Yo besoin de la vie.
Culture, société, politique, économie, santé, environnement, géopolitique. Un franc-parler avec Ronald Léon chaque mardi 7h 8h PM sur le PCVI Network. Ronald Léon Show, le show le plus chaud du web. Suivez-nous sur notre page Facebook, la chaîne YouTube et le site d'internet de PCVI Network. Enfin, sur la page Facebook de Ronald Léon Show.
Well, I hope we did enjoy one of Dr. Bazik's music, but there is more coming because he told me the music I like. I guess a lot of people like too. It's supposed to come soon. We are working on it.
Yeah.
Okay, but as I said to you, we are in one of the segments that's very important. We're going to learn a lot from Dr. Basil because December 1st was the National HIV Day. Now, Dr. Basil,
Yes.
but I'm just going to let you talk. I know a lot of people know what is HIV, but some people may don't even know. I want you to give us an overview, a summary of everything. Go ahead.
All right. So HIV, human immunodeficiency virus, is a virus that causes immunodeficiency in the human body. And when that immunodeficiency is severe, then it can get to disease. That means that person will start experiencing a lot of symptoms and signs. And at that point, that's when it becomes AIDS, which is acquired immunodeficiency syndrome. So when that happens, then that means the immune system is significantly altered or damaged. And that patient, if we might use that term, will be at risk of contracting or developing a lot of what we call opportunistic infections. Opportunistic infections are basically infections that normally would not cause any disease in that individual, but because of the deficiency of the immune system, then there's no response, I would say, strong response enough from the body to kind of face that potential infection. So that's why when that happens, that person can be at more risk or can develop other type of infections such as tuberculosis or pneumonia or other type of infections. And usually that has to be treated very, very aggressively and very seriously. In the past, in the I would say 1990s, 2000s, they used to monitor people who are living with HIV, and depending on the CD4 count, which is basically some cells that are part of the immune system that usually would fight against the virus, and based on specific threshold that they had, they would decide to start treatment. However, it's like you're waiting until that person is getting very significantly sick to make a decision to start treatment. So that's why that approach has significantly been changed. And now it's test and treat. You test someone for HIV, that the test comes out positive, then you decide to start that person on treatment. And currently, particularly here in New York, there are programs where they are even talking about what is considered as immediate antiretroviral treatment. Antiretroviral, those are the medications that are used to treat HIV. And immediate antiretroviral treatment is basically when the treatment is established or initiated between 0 and 4 days, so that you can make sure that whatever is going on, even if the person looks healthy and okay, but you don't wait until they become sick to start them on treatment. And when you do that, you are putting them in a better situation, in a better position to live comfortably with the disease and then be able to take care of themselves, take care of the families by going to work, etc. So one thing that I would like to say here before going any further is that I would like to share with anyone living currently in the US, particularly in New York, or anyone in the world who are currently on treatment for HIV/AIDS or are basically taking what is called pre-exposure prophylaxis, because there are ways as well to prevent people from getting infected, pre-exposure prophylaxis. There are also ways to make sure that people who might have been exposed to HIV, to avoid them to become infected and then develop the disease at a later stage, and that is post-exposure prophylaxis. So recently there have been some concerns about the side effects caused by one of the drugs that are used for pre-exposure prophylaxis, particularly Truvada. Truvada is a combination of 2 drugs that are used mainly, or I want to say exclusively, for the prevention of HIV. And recently there were some patients that basically taking that drug that initiated a lawsuit action against the pharmaceutical company that made Truvada because of those side effects that they were seeing that they were experiencing. One thing that I would like to share with everyone here is that Truvada is completely safe for the prevention of HIV. So someone who was considering to use Truvada for the prevention of HIV should definitely continue doing so. There's no significant issue with the use of Truvada for the prevention of HIV. Of course, with any medication that someone is taking, there are always side effects. And those side effects, when you discuss them with your primary care physician or your specialist, the one who's taking care of you, those side effects, they can be addressed. But the main thing is not to stop taking your medication. If you have any issue, discuss this with your primary care physician. That I wanted to really get that straight, because I think when we have people making statements in the news, because I know that some of the viewers here might have heard of this, that was in the news, that was on paper, that was also in TV, and many people were saying that they should stop using Truvada, and I don't think that's the way to go. I think we should continue educating people, making sure that they make the right decision and they discuss anything with the primary care physician. The other thing I wanted to talk about quickly is the efforts that have been made in terms of addressing HIV across the globe. I can vividly remember back in early 2000s when I started working in Haiti in the field of HIV prevention and treatment, and many people were dying because access to treatment was still very, very limited. We were still trying to figure out exactly how to deal with the disease. So there was a lot of stigma and discrimination against people living with HIV. However, I'm not saying that there's no more stigma. There's still stigma, there's still discrimination. But I can confidently say here that I've seen a decrease in that stigma and discrimination. It's still there. We need to still fight it, but there's a decrease in stigma.
Well, thank you, Dr. Basile. That's a big, that's a lot. You give a lot of information. But I'm taking a lot of, you may see where Dr. Basile talk a lot of big term, stuff like that, but we're going to get to basic.
Yes.
Now, I used to work in the hospital, and when someone gets stick by a needle, some of the hospitals, I don't know if all of them, but based what I know, New York Hospital, Queens, they automatically advise whoever the employee that gets sick, not only to do the blood test, stuff like that, to get on treatment.
Yes.
You know, what's your intake
So
of this?
one thing that I would like to say on this, needle stick happens quite a lot in the health facilities, right? However, the likelihood of getting infected from a needle stick, if the person was wearing gloves, if the person has the right approach after being pricked, is really, really, really low, okay? Because while the needle is going through the glove, anything that is on that needle will basically be kept on the glove. That's one thing. However, to be on the safe side, someone get pricked, someone has a needle stick, the main thing to do is to see a primary care physician, or we can say an infectious disease doctor that will address this situation. And yes, it is very encouraged to be put on treatment for that, to prevent any infection when that person has that needle stick.
Okay, that's good. And because what we try to do in PCVI Network is educate a lot of people. I know I will ask you more questions as far concerning HIV, because December 1st, to remind everyone that just get to the show now, we're talking about HIV, because December 1st was National HIV Day, and we have Dr. Basil, which is an epidemiologist, and we work with New York City Department of Health, and we work throughout the world, in Africa, in Haiti, that have a lot of intake dealing with this type of situation. Now, the question the reason I asked you this question in the hospital, because some of the employee doesn't want to get on treatment. Some of them said, I'm not going to get this. Do you take, what message you have for these people?
So yeah, I can try to understand someone who would be reluctant to start treatment because they were pricked at the workplace. However, my message is simple and clear. It's better to be on the safe side. It's better to prevent than to be regretful after a couple of weeks or months. Because, you know, when you get a needle stick, you're at risk of getting infected. So it's better to make sure that, because yeah, some people might be worried about the side effect, like, because, you know, the antiretroviral medications, they do have side effects. Like I said, like it's the same for every medication that someone might be taking. But the key message is here: you get a needle stick at the workplace or wherever. You have to follow the workplace protocol of the workplace. Yes, and then basically see the primary care physician or the infectious disease specialist, so that, you know, your situation can be appropriately addressed, and you can have peace of mind after a couple of weeks, once you will have taken all the 4 weeks of medication. Because if you don't do that, then you will constantly be having that, you know, going into your mind, thinking that maybe I was at risk. Well,
I know a lot of medical facility, not only the person you get sick on, usually they do the blood test, they get the consent for this person, they do the blood test for them to make sure if they don't have HIV. And they do the blood test for the employee also to make sure, because they try to prevent any lawsuit also, you know, stuff like that. Now, we talk about the employee, the healthcare employee, but I want you to give, because, you know, I'm in New York City, infection control provider. We deal infection control. You talk about the infection control, because you can see in the hospital, in all departments, all hospital now, they have a lot of people talking about hand washing, safety protection. You see all kind of different needle, and they advise you to use one needle. Now, what advice you have for the healthcare professional, the doctor, the surgeon? Because sometimes some of them just go, I don't know if that still happen, but on my time, some of the old-fashioned doctors stick people with no gloves. You understand?
Yeah.
And you know you're on the field, you're in the country, you know what happened in Brooklyn like a couple of years ago in one of the practice, where one needle was used on several people. That affect a lot of people, not HIV. That time that was hepatitis B. They give to those people. What message you have for them, for a lot of people that's watching now?
So yeah, I mean, you were talking about what is happening in New York, but to me it doesn't make any sense to have such situations happening in the wealthiest country in the world, right? Because if we are talking about resources, they are available. I strongly believe that we do have enough resources in this world for everybody to live a happy, safe, and comfortable life. So to me, it doesn't make sense to have situations where, you know, several people are being injected with the same needle. I don't understand the rationale behind that. The key message that I have here is that, you know, we have to use the tools that are at our disposal to make sure that we take care of the people that we are serving. If you are a medical doctor, if you are a physician assistant, if you are a nurse, whatever your role is in the healthcare system, if you're gonna provide services, you have to follow the protocols. You have to wear the gloves like everybody else does. There's no reason why someone would be willing to put their patients at risk and put themselves
Yeah,
at
but
risk.
there is another
Okay.
thing too. I know you're going to take it in consideration. Maybe that doesn't happen to you because you can talk with some of the doctor in Haiti too. You understand when we talk, because we both was in the State University of FMP, Faculty of Medicine and the Pharmacy in Haiti, and when we said talk about the safety issue, did they have enough like sharp container to put those safety needle? And because I don't know if now, on my time, when people finish use the needle, sometimes they just put it somewhere. And that even happened to me when even I went to North Shore for my first job. Because they was asking me to stick someone, and I finished to stick the person, I just put the needle in the garbage.
Yeah.
And they said to me, the same thing happened with the previous doctor from Haiti that came here. You know, I'm just talking because a lot of them are watching you now, and what message you have for them. And after that, I want what message you have for people that not in the medical field, and for people that using needle, that using drug, you know, stuff like that.
So the simple message is that for every single patient, there should be a clean, a new set of gloves. That's one thing. If you are using syringes in the healthcare facility, there's no reason why for anyone to be recapping or putting a cap on a needle. There's no reason for that. We have sharp containers. They should be used, and they should also, someone in the health facility should be responsible to monitor the use of those sharp containers and to monitor when they are completely full, and then they should be replaced or they should be discarded, etc. So there should be a system in place to make sure that those sharp containers are appropriately managed, Stericycle or whatever we have in terms of services to take care of that should be used consistently and appropriately. And the other thing I want to say about, you know, the healthcare system, particularly in Haiti, yes, we were there. We know what are the challenges, and I think the challenges that we were facing when we were in med school and we were also in the state university in Haiti, I don't think that they have completely disappeared. I'm confident that there are still some challenges there. However, I think when people have the knowledge, they should make use of that knowledge appropriately. Sometimes we do have the knowledge, but we don't have the tools to apply,
Yeah,
the
because
knowledge.
I'm going to say something here. The reason I'm saying, if that still exists, and I would say a lot of us that watching this today is a lot of Asian physician in the United States and or in Canada, all over the world, that may have the opportunity. Because I remember when I was at the State University Hospital, sometimes people get a gunshot, sometimes people is bleeding, you're washing them. It's not like you don't know what to do. You don't even have the gloves, you don't even have a gauze, stuff like that, to even do the basic early intervention stuff. Now, if that still exists, I would say this is the time now. We're talking with our Asian people. This is the time, or we're talking with everyone watching the show that may be related to this cause. If the hospital is still the same way, if we can find a way to support that hospital. Because I heard a lot of doctors say they try to send an ambulance south to Haiti. When they get over there, they cannot get them. But we're talking about with whoever in charge over there. Even this show is not about this, but we take the time to advise everyone to try to support the healthcare system in the country. Because we come there, we would love everything to get better.
Yeah, definitely. And then one comment that I would like to make about the what you said earlier related to people who are injecting. So yes, and if we are now talking about what is happening here in the U.S. where we are currently living, there are people who are injecting, who are basically injection drug users, intravenous drug users. Basically, those people, they use either opiates, and they usually inject themselves, or they have people injecting them. And that's basically an issue at several levels. One is the opioid crisis that is currently ongoing in the US. Two, the risk of contracting a lot of infectious diseases, particularly HIV and hepatitis C. For HIV, since we are talking about World Day, one message that I have for people who are injecting drugs is to really make sure that you do not reuse syringes. Even if you were the one using it the first time, reusing it, you're putting yourself at risk of damaging your veins. That's one thing. Because every time a needle is used, it doesn't have the same potentiality, it doesn't have the same shape, particularly what they call the bevel, I think, of the needle. That's one thing. The second thing is, if you are using, it's very important to make sure that you use clean needles. If a friend of yours was using a needle, there's no reason for you to go get that needle and use it. You're putting yourself at risk of contracting infectious diseases, and we don't want that for you. So there are a couple of harm reduction agencies across New York City, for instance. I'm currently working with one, and if you need clean syringes, you can reach out to those agencies and get clean syringes. As of now in New York, for syringe exchange program, there's no limit on the number of syringes that one client or participant or patient can get. If you need 200, you can get 200. It depends on how often you use and how many you need in a day. We can provide that. If we do have another program that is called Expanded Syringe Access Program, ESAP. In that program, usually it's in healthcare facilities where basically about 10 syringe maximum can be given. But we do have, on the flip side of that, the syringe exchange program where you can get more than 10. So if you need more, you can get more. There's no reason for anyone in 2019, close to 2020, to be using syringes that were previously used by someone else. We don't want that for you because you are putting yourself at risk, and we don't want that for anyone else. So please, if you need services, look online, call, and we can provide those services.
Call which number?
So,
what the name of organization?
So
because
yeah,
if you said call,
of course I'm going to provide this.
yes.
So yeah, I currently work with New York Harm Reduction Educators, and the number to reach us is 718-842-6050. If you call that number, 718-842-6050,
Okay.
you will get access to all the services that we have to provide.
Okay, that's a lot of information. Just to let you know, for a lot of you that are watching now, as you heard Dr. Bazet say before in the beginning, HIV, getting HIV in a needle, the risk is very low. We focus more, even is National HIV Day, we're more focused on the safety aspect. That's why we go to needle, because even the risk is low, you don't know. You may be the one that's unlucky. And also, he doesn't want you to get hepatitis B, or whatever other condition you can get. He doesn't want you to get that. Now, as we talk about reusing needle, we can grab all this barbershop also. Because there is a lot of barbershop, there is a lot of that using, and it's not like that using the same thing over. We can educate you, try to use one, make sure you sterilize whatever you're using to clean, stuff like that.
Tools.
What message you have for them before we go?
So yeah, it's really interesting what you were referring to, because we do know. I go to the barber shop. I'm assuming that you also do. So
the female we go to do her nail also too.
And it's extremely important to make sure that when you go to those places, the provider, the person who's offering you the services, take good care of you and protect you, and make sure that that person sterilizes the tools that they are using to cut your hair or to do your nails or whatever services that you're getting. Because, like I said, in the case of HIV, any type of skin exposure where basically there's blood vessels and there's blood, if there's a tool that was used by someone a couple of minutes ago, because there's a couple of places where people don't really necessarily use any substance or any tool to sterilize whatever they're going to be using to provide services to the next client. And when they don't do that, they are putting that client at risk of contracting those type of infections. That's one thing. There's one comment that I would like to quickly make in terms of the infections that you were talking about. You talked about hepatitis B. Yes, and that's one type of infection that is very often contracted by healthcare professionals in health.
Yeah, because I know a lot of OB/GYN doctors.
Right?
It's not like they choose that.
So normally, there are vaccines for hepatitis A and hepatitis B. However, there's no vaccines yet for hepatitis C. So that's why for people, I was talking to the people who are intravenously using drugs, to really make sure that they take the necessary steps to prevent infection. Because, like I said, that's why in the healthcare system, when a new resident or a new doctor is entering into a hospital, they always make sure that you get the vaccines for hepatitis B, right?
No, it's not when you get to residency they do that.
No, I mean,
don't do that.
What I mean is that,
because
they always make sure that you get vaccinated.
This is a law. All job, when you start working in any job, they ask you to do a physical.
Yes.
On the physical, they want to make sure you get this type of vaccine. But if you don't want to get them, they give you a waiver form, and you can sign. Like if something happened to you, specifically people that go into work in the blood bank or in the blood stuff like that. But what we advise you to do, we're here to educate you. We have Dr. Basil. He gives a lot of information. I know we can take the whole afternoon talking about HIV. Now, before we move to the next subject, as you know, you're on PCVI Network, and one of our goals is enhance, is educate, enhance quality life of people with vision loss and blindness. We have some people that get HIV and that lost their vision also. And we're going to show you some of the picture. We're going to show you what the eye look like, what the back of the eye look like, and what they see, and we're going to share them with you, but we still have more to go with Dr. Basil in the next segment, but we don't want to, because we have a lot of PCVI fans that been asking us what's going on with the eye, but what we're doing in the HIV is very important also.
Yeah.
Now, we're going to show you some of the picture. As you can see, this picture you can see, this is the back of the retina of someone. Some people may see that look like a diabetic eye. Yes, it does look like a diabetic eye. The only difference, you can see all the bleeding. Because as Dr. Basil was described, the HIV, what it is a human immunodeficiency syndrome. Now, this person, the immune system is down. The defensive system of this person is not working. That means this person is exposed to anything. Any little thing make it worse. That's why you see the blood vessel is completely damaged. This is, as you look at the second picture, this is someone that not only has the virus, that have the disease. I don't know if we have time to talk about that with Dr. Basil to the show, maybe another show, or Dr. Basil will have a show too with us, that healthy music for health. He will have time to talk about it. And as you can see, this is someone that have the disease. This is on the back of the eye is seen. Now, I want to show you, a lot of you, if you don't go to see an eye doctor that can do that picture, you will not be able to see this. But I want you to see, you don't have to go to an eye doctor. This is some of the lesion someone with HIV can have, like this one. A lot of people may do some research on HIV. They may heard about something called sarcoma de Kaposi. They may ask why it is. But this sarcoma de Kaposi doesn't go in the skin only. It can go into the eye also. As you can see in the eyelid of this person, a couple spot, dark spot, a couple lesion in the eyelid, and even it go inside the eye. As we can go, we're going to show you another picture. This is a complication. Now, when you see those situations, that this is not a situation we want to be in. Now, your question should be, what should this person do? You should see your eye care doctor, and get it treated. It can be treated. That's been what we used December 1st. That was National Day HIV Day. We want to let you know, even you have the disease is not, by matter of fact, in the United States, HIV is not a big deal. No more. I'm just, the epidemiologist disagree with me. I would have given him time to answer. But the reason I said that, because they've been more afraid of hepatitis B or C more than HIV. But this is what is not what it was to be before. But we don't want you to have this type of lesion. As you can see over here, this is all the lesion people with HIV may have in the eye, but they can be treated. It's not like as you see your regular doctor that taking care of the infection for you, you see your eye doctor. Now, you can have dryness of the eye. Some people doesn't have those big lesions I show you, because the big lesion, last lesion you see I show you before, this is people that already have the disease, but people that contacted that an early stage, they may have dryness. They may see flutter. We're going to ask to show you more picture. Now, as you can see this one, now this is someone that have dryness. The eye is dry, the eye is red, and sometimes they have blurry vision. I don't want you to take, they may have difficulty to see color. They may, like you can see this picture, they see blurry. But sometimes you may go to when you go to your eye care specialist, they will be able to help you. Now, if one of you, you may went already, they said they cannot do for you, well, ask them to give you a referral. Go to Yellow Vision Rehab Facility. We always say that to you. And as you can see, the last picture you see, this is blurry vision. Now, this person is looking at the kids. This is what the person see. It looked like a cataract, yes. And if you didn't have, but if you already have a cataract surgery, you still see blurry. And your doctor will say to you, this is what the lesion the HIV give you. And there is more the picture than that. They can give you change of color. And as you can look at those two pictures, you can see one look clearly, and the one look one look like green, and the other one look like blue. Guess what? The white color is green. But the person that have this disease, because some of the structure in the back of the retina, what they call, is affected, the person see the picture like blue. It's not like the person is faking. I'm just educating you. This is what the person said. Now, if you come to the press center, we will do a sun lens evaluation for you. We will give you the proper sun lens that make you see the picture the way it's supposed to be. Like this is a color vision test we will do for this person. The accurate color is supposed to be where you see the green color, but the person only see the other side. Now we can have more for you, but this is what we have for you to show you. December was National HIV Days. HIV does affect the eye, but we have this for you. I don't know if Dr. Basil has any question, Any advice before we can move to the next segment? And as to tell you, the next segment, because December 3rd was International People with Disability by United Nations. That's a big topic too. You know, that will be the next segment. But before we move, we would love to get Dr. Basil the final word.
So yeah, like you mentioned, Dr. Prince, the month of December is a very interesting month, right?
Yes.
Women's Day and National Day for people living with disability. So there's a lot going on.
Yes.
But all that is going on with music as the common platform, right?
Yes.
And we have to continue talking about that. One thing that I would like to quickly mention regarding the Women's Day, that before we move to the next segment, is you were talking about how now, you know, more attention is being paid to hepatitis C than HIV. So yes, because across the globe, I think that there have been a lot of significant effort being made to address the epidemic. And now that's why we are making sure that we are moving towards having a chronic disease, because HIV, now we have people living with HIV or who have been living with HIV for 30 years, 35 years. Some of them, they are completely undetectable. Undetectable means that the quantity or the level of viruses in the bloodstream is significantly low. And when that happens, now the other concept is untransmittable. So you, undetectable, equals untransmittable. So that means someone with an undetectable level of HIV viruses in their bloodstream cannot transmit the infection. And all that is basically, if we are now going to talk about New York, what is happening here where we are living now. So there have been a lot of effort to really address the epidemic. Mayor de Blasio and also Governor Cuomo started this initiative, Ending the Epidemic, ETE, to address the HIV situation. And that's why this year, I mean, very recently actually, we were looking at the data for 2018, and we found out that in 2018, for the first time since HIV has been, I would say, mandatory reportable condition in the US, for the first time in 2018, the number of new infections, new diagnoses, has been below 2,000. So in 2018, it was about 1,900 people that were newly infected, newly diagnosed with HIV infection. So that is a significant big step towards really eliminating the infection, because the lower new infection that you have, the lower risk for getting more people infected, because that way we can make sure that we continue with interventions that can help with preventing the HIV infection. So I think that's very good. That happened in New York City, so they were looking at the data and then found out that there's a significant decrease in new infections. We are still a little bit far in terms of the 90-90-90 targets. 90-90-90 means 90% of the people who are living with HIV should know their status. And out of those 90%, 90% of the people who know their status should be put on treatment. And the last 90 target is basically 90% of the people who are put on treatment should have viral suppression. So that means should be undetectable. And when that happens, as I said earlier, then that means those people will be very, very, very unlikely to transmit the infection to other people.
That's good. That's a lot of information, Dr. Basil. I don't know, I know you will have a show with the PCVR Network. We keep saying it. Dr. Basil, we're going to have a show in PCVR Network, Music for Health.
Yes.
And I hope everyone who's watching. And that's everything is about education. and or to help you live longer. This is what we're doing. We give you a lot of information. Now, before we move to the next segment, I just want to remind to everyone that just come back to the show, we have Dr. Basil. He's an epidemiologist and working in the field, not only in the United States, he work in Africa too, with people with HIV. He work with in Haiti, and he give us a lot of insight. And we know the support system here is a lot. And as we're talking, we have to we know there may be some people, because yesterday in the French show we have some people that asked us to pray for them. What we do, and if there is a lot of people that still not accept the reality, that still in searching, that still need help. When we talk about help, there is as for a counselor, there is a lot of organization that's available. There is a lot of state agency that's available. But we at the Prince Center, we have a priest, Reverend Bruno, who is a counselor that pray for a lot of people in several hospitals. He is available. He's volunteer at the Prince Center, because we are a non-for-profit organization. But he is available for everyone that would want to get someone to come to pray for you, to help you, with any condition. Now you don't know where to go. You want him to pray for you, and you will be welcome to come to his church, but he will be welcome to come to you too, or to even meet you at the Prince Center. Most likely he's not going to pray for you with you at the Prince Center, but he is open. We just want to give you that advice, because this is what we are for you. That's what we have. But now, before Dr. Basil, we move to the next segment, will be, as we said, December 3rd was International Day of People with Disability. And we're going to take a quick break, and we will be right back with Dr. Basil. But even he is an epidemiologist, he will put his feet in. Am I?
Souple, mandez pour moi si c'est ici qui c'est PCVI 550 West Merrick Road, Valley Stream, New York 11581. Nous traitons.
Oui, nous café sans famille. Oui, nous café sans amis. Oui, nous café sans famille. Oui, nous café ça.
C'est glauque comme fait nager. Ou ka tete?
Oui, nous café sans famille. Oui, nous café ça. Nous café ouais.
Cataracte fait pas ka ouais ko sou ka tete?
Nous café ça.
Depuis cycle la prend, m'pa ouais ménager comme si ou tout. Tension j'aime toujours à monter descendre.
Café ça.
Nous capable? Pas gros côté opération ouais. Qu'on y a là ou possède depuis vin là bon.
Oui, nous café
Reste
ça.
dans tout posé. La journée mouais. Depuis l'angélisme pas rien. Ou ka tete?
Café ça. Nous café ouais.
Depuis au monde devant moi mosso pas un mosso.
Café ça.
Comme si tout bon nous ka tete?
Nous café ouais.
Eh ben nous même ça nous est ici.
Nous café ça.
C'est vrai?
Nous café ouais.
Bon ça nous y est depuis m'vini là. Ma point.
Téléphone nan c'est 516 238 50.
Well, we are back, and as I said to you, in this segment we're going to talk about, because we know December 3rd was International People with Disability, most likely that's celebrated by United Nations. And I have a couple citation, because the annual observance of the International Day of Disability for People was proclaimed in 1992. It's not something we're just coming out now. I just want to let you know it's something that's been going on. But as a low vision and blind rehab facility, we have a lot of people with some form of disability. And we deal with them, because a lot of people that lost their vision, a lot of them have some other issue. A lot of them has what we call that multiple disability, and we deal with them. And I'm not telling you the truth, but I'm not giving you a big news. You may didn't know if December 3rd was a National Observance Day, National Day for Disability People, unless you were related to the cause. But now, since you're watching PCVI, you want to see it, because you will see They have their own logo that was all over the place. And these are, when we talk people with disability, me, I'm going to focus on the vision, but I know I have Dr. Basil that been all over the world. He's going to focus to everything. When I said everything, most likely people that lost arm, that lost leg, or that lost something. You understand? And that a lot of people take people with disability missing something they cannot do, or that may prevent them something, which is not true. Because what this show is about is to let you know these people, they may have a disability, but they can do whatever you can do, they can do it. I've been saying that at all my show. When I was at Sardis University, I have a lot of classmates that was completely blind. They take the same exam like me. And sometimes they have even better score than me. I'm just explaining to you because don't think in these people and by matter of fact, research prove it. Because they were putting someone without have two eyes working in a facility, and they put someone that completely blind. The person that do more mistake is the person that have the two eyes. Because I'm just explaining to you because there is a way of living. These people, even they may don't have vision, but they can see in their own way. They can do things in their own way. As you can watch in Hijima, she was at Harvard University and she's a lawyer. A lot of people, she's a well-known figure. Because if United States, you don't know her because President Obama did receive her, stuff like that. And it's not only her, there is more than that. There is more people you can see. I'm talking more because I'm in low vision and blindness. The previous picture, you just see this person. She doesn't see, she doesn't hear. She's deafblind. She be able to do everything. As you can see, the winner, we just show you. And there is Stephen Wonder, as you know, everybody know that you may like the music, but he's blind. But for the Asian people, there is a couple of people, I guess, there is a few guys that's lost their vision.
Ray Charles.
Yeah, Ray Charles, I guess
amazing
musician, that blind. Now, to get straight to the subject, because the goal, the term for DC was promoting the participation of people with disability and their leadership. That means not only we are promoting participation, these people on everything. That means we don't want you to take, the state has to force you to do things. Anyway, there is law. Because because I see a lot of that watching the show now, if you all know, if you're going to open a practice, it has to be accessible. If you want to get all the insurance, they ask you, do you have wheelchair accessible? Do you have a bathroom accessible? Do you have everything? Now, one thing you don't have yet is make sure the communication for people, for all language. When I said all language, people that blind, completely blind, when they get to your facility, they have to be able to see, to read where your office is, to see you, to feel you. This is the fight we have now because so far some of the hotel already accommodate. You may see when they put their home number, they write it, or they put it with the bold, not only bold letter, a letter people can feel, or they put it in braille, and some of all the stair also, they have it. But even if you go to the precinct, come to precinct, you will see it. If you go to some other state agency, you will see the accommodation. But we are fighting for all these people. They don't have to ask where is the doctor office is. They can see it. Because I remember when I was inside this university, I was in the same, I did stay in a location that was close where my classmate was, but she doesn't want nobody was telling her where to go to her home. She knows. She just go by herself. She know where her home number is and skip step by step. We are fighting for that. And that's what that day, that December 3rd was the day a lot of people, we use that day to promote this. And because they have a goal. And before I get Dr. Basil in, I want to read the quote of the UN Secretary General, and that Mr. Gutierrez. What he said, when we secure the right of people with disability, we move closer to achieving the central promise of the 2030 agenda. That means they have an agenda, and they want everyone to respect their right, stuff like that. I don't know if Dr. Basil have anything to say.
So yes, I do have some stuff that I would like to say about that. And the first thing I would like to say is that I do not consider, someone who lost an arm or someone who is blind, someone who lost both legs as disabled. I consider them as differently able people.
Okay.
Because, like you were mentioning earlier, when you were taking your exams, some people were blind, that they sometimes would have better scores than you. And I have personally met some musicians who are blind, but who would be more sensitive than, I would say, other musicians that can see, that have full function of the both eyes. So that means people who are blind, for instance, they can be considered as people who are disabled, but they have other ways of interacting with this world that is surrounding them. And sometimes they might be even better musicians than people who have all the faculties. So that's why I consider them as differently able. The other thing I would like to quickly mention is that, in this country, and I think also in the world, there are a couple of conditions that are considered as disability. And actually there's a list. For instance, if you go online now and you are applying for a job, there would be a list of disabilities or disability or condition that they would ask you, do you live with those conditions? And in that list, there are also mental issues, like people who are living with major depressive disorder, people who are living with bipolar disorder, etc. They consider them as disability. But like I said, in my view, those are people who are differently able, because some people who are considered as disabled sometimes can be even better at what they are doing than other people without, or let's say without disability. So I think having a statement like that from the United Nations General Secretary is really interesting, in the sense that it's giving people who are living with disability a platform so that they can have specific goals and things that they want to achieve and realize in their own lives. And I think here in Prince Center, when you basically have people coming with vision impairment, they come and they get services. But one of the things that I think is key here is that when people come, they get services. Even when they are coming, they also bring something to the table, right? Because those are people that have that, might be in very high level position. They might have had, wonderful, amazing, and very comfortable lives. So, like I said, they are different. They are able in their own ways, but sometimes they can even get better grades than Dr. Prince.
I told you that. This is a fact. Well, some of the people that have the opportunity to get trained, you will not even see them, because there is a device called Iris Vision. We have it at the Press Center. A lot of people can see. You will see it. You see, it's a big device that that helping a lot of people that have what they call macular degeneration disease, that cannot see. If their central vision is out, a lot of them would like to watch game. They cannot see them. This guy, he has macular degeneration, but he gets trained. And he come with this device, because when he walk here, he is the one that make it. He was trying to explain to me. I said to some of my patients, because I didn't have him come in and explain the device to a lot of my patients. And she said, I said to them, he has this, even the condition worse than you. You don't even see it, because he trained. He know where to look. Now, that's what now, a lot of people with disability, you may think they can do more if they get the opportunity. They can do more if they know the services that are available for them. This is what we, not only we try to get them involved, when we say we try to get them involved, we involve in the battle with them because they are in Washington, they well organized, they try to get in and make everything the way it's supposed to be. But Press Center, we are serving, even we focus in low vision, we get a lot of people with disability. It's unacceptable sometimes. I have some patients coming far because they cannot find an eye doctor that can see them because with their chair, with their wheelchair, and that accessible. You know, they say to me, well, all place I call, they don't have that. All place I call, they don't have that. We are fighting for that, to make that happen for everyone. You know, stuff like the same reality, even in the school, because sometimes they have special school for special people, stuff like that. Well, the reason all these things is created is because the opportunity is not open, like we call about early intervention for a lot of people. If they didn't know, because recently I have a little kids, because all these things that's going on from Haiti, but his parent was paying $500 US every month in a school, special school in Haiti, which is good. I'm glad there is this type of school. But when I'm looking at the little girl, she is not a special kid. She just has vision issue. She just have a strong astigmatism that make her walk like this. And they think she is deaf because the reason she walk like this, because she doesn't see in this eye. She tried to look with that eye. When I talked to her, she said to me, you know what, she said to me, when I used to try to look straight, my friend is trying to make joke on me. And I start doing like this. And now they think she's stuff like that. This is what we're talking about. Ask for information, because sometimes you don't know. I don't say some of the kids may really have special need, but if these kids did have the opportunity to get early intervention at early age, their parent will know. If the parent was able to get the opportunity to watch show like what we're doing here, they will know. They will ask questions. What is early intervention? What is this thing? This is those type of questions they could ask. Because as we're talking now, I see one of the persons said to us, when we said these people should be able to be, the communication, they should be able to communicate everywhere they walk in. They should be able, at the door, when they touch the door, they should be able to know where they're going. They're supposed to get specific site. I know there is a lot of improvement that's been doing, and I'm in the state of New York. And I would say, as for the street sign, you see, even to cross the light, they put some stuff stuff like this is being done by orientation mobility specialists, which is a big improvement. Even when they take the bus, you see the bus is talking and tell them this area. This is a good improvement, but there still be more to be done. We want to, any restaurant we go, if you call yourself a restaurant, you should be accessible for everyone. This is where our fight is. Because whether you like what we said or not, we try to make it accessible for everyone. Now,
in that vein, I would also like to make a comment about the American Disability Act. For instance, you know, when you have a business or if you have a non-profit organization, it is required that you comply to the American Disability Act to make sure that you have appropriate access to people living with disability, so that particularly physical disability, to access the building where you're providing services, right? So it's a way to make sure that everyone, no matter what type of challenges or disabilities that you're dealing with, you are part of this society, and the society takes the necessary step to make you feel comfortable and make you feel that when you need services, you can go somewhere and get those services. And I think
one thing we're going to say, even there is a lot of law for all these healthcare facility or all this business, all this big building, because recently I know there is a couple of big building. The owner was required from us to come teach infection control for them, because the state said to them, for them to be considered themselves as a healthcare facility, all their employees, the cleaning people to the top, they have to be efficient control certified, and which is a big thing. Now, one of the things we see most likely at the school, because even the school try to accommodate, but the teacher, they don't have the knowledge or to deal with this, with people with disability. Or even in the healthcare system, because I can go from a nurse, from a primary care physician. A person may come in, they don't know how to interact with them. Even at some assisted living facility, because when I was doing my internship at Vision, they used to send me to see patients in some assisted living facility. When I look at the people that take care of the people that doesn't have vision, they don't even know how to communicate with them. And this is the stuff we're talking about. It would be nice for this place to train their employee. You know, get professional in the field, educate them, or to deal with this type of people. And not only we talk about the healthcare system, even some other people, because there is a lot to do, because we go into, because sometimes you just feel like it's like a ignorance, because they don't even understand. Because when I said understand, I'm just saying that because sometimes I have a patient come in here, the kid said he's faking. These kids are yelling at him, but he doesn't see, or he's looking at the wrong way. You know, there is a lot, but the reason for that, you cannot blame them, is because they don't know. That's why we try to educate you. There is not only Press Center that can help you. There is a lot of state agency. If you have questions, you can get help. There is American Foundation for the Blind. There is National Federation for the Blind. There is a Vision in the City. There is Zelen. Well, I don't know too much about Nkele. That's why I'm not talking about it. But there is a Commission for the Blind. You know, beside the Press Center. But if you call any one of these agencies, specifically Vision, because I know Vision has a good team, because I was there. I know they have a good team, you know, stuff like that, and specifically for kids, because they even have some good activities, stuff like that, for the kids, stuff like that. Because there is services available, because this is where our focus is. We are non-for-profit organization. We try to, by the end of the end of the year, that December, this is a month, as we talk about this is a safety toy month, a month of a safety gift month, a lot of things going on.
Expenses.
A lot of expenses. There is no better gift, I would say to you, if you want to give your parents. And, you know, make sure you can, you know, I have a lot of low vision patients. I'm just going to let you know. There is a lot of low vision patients that need help. We would love to help them, but the low vision device, the low vision glass done by Design for Vision. I said Design for Vision. I said architect, they're expensive. And Press Center doesn't raise any money. Because I know we are getting there. We try to help a lot of people. As a non-for-profit, if you don't raise money, it will be hard for you to help to give for free. And we are currently trying to do a raising fund for one of our patients that's 88 years old. She give me the okay to say her name. Her name is Lisbon Senatis. She's been going to several doctors. Recently, we sent her to a retinal specialist. They said they cannot do anything for her, but she still has some vision. But she wants to be able, when she is home, to watch TV. We want to get her a bioptic, that device that can allow her to see well. If any one of you may have one, you're not using it, or either from Design for Vision, most likely, they are the one that make it, or from Acuitet, she will greatly appreciate it. Now, if you cannot give it to her also too, you know, you can give some cotisation. We're doing for some reason, not only for her, we have some other patients also that don't want, we don't have the okay to say their name, that we promise we will help them to be able to read, that still have some vision. And this is, because I would say we are tax exempt, there is no better than if you can help someone that was in the dark to be able to see. Before we go to the last segment, which is patient testimony, because on this show, the last segment is our patient, that we don't want to just talk about Press Center just ask you to write review. Someone can just go online and write a review for you. The patient physically said, I want to talk for the president. Some of them that speak English, we put them on Healthy Vision. Some of them that speak Creole, we put them in Santé Vision in the Creole. I don't know if Dr. Bazila have a word to say before we move to the next segment, which will be the last segment too. Mm-hmm.
So the comment that I have now is, how music, right? Like I said, music is the common platform where everything that we are talking about here, relies. So someone who, let's say, was born and that person has been in all the activities on a daily basis, and then suddenly that person start experiencing some vision issues to the extent that they might become blind, or they might have some significant problems with their vision. They can come to you, Dr. Prince. However, one thing that I understand, and everybody, I guess, who is watching the show now would agree with me, that when that happens, even either a physical different ability, like I said, for the people, even if it's physical or it's mental, whenever those type of disability, I don't want to use the term disability, but I guess in that case I can use it. So that can bring a lot of other pathologies, other issues, depression, for instance, because you feel that, wow, I don't have the capability to do everything that I used to do, okay? But one thing that I know for sure, music has the capability to help in those instances to make sure that people feel better, because that's the thing with music. It helps you to feel better. Music gives wings to the soul, Music can take you to places that you would never even dream of. And like, one of the most amazing musicians that is well known across the globe said one day, and I'm talking about Bob Marley, music is the only thing, when it hits you, you feel no pain. So someone might be experiencing some disability, and that because of that disability, they can go to a very deep and dark, I would say, situation in their lives. Some people would just go to alcohol, other people would go to drugs, etc., because they are trying to deal with that new way of life. But music has a way to help.
I agree with you. And one thing I'm going to try to, my experience with a lot of people, that's when they just lost their vision, and they went through a couple of phases. And before they even go to depression, some of them, they're very upset. Some of them are in denial.
Exactly.
Some of them is going to doctor, and because they believe this doctor is not telling the truth, and as the condition is getting deteriorated. And now, when they finish, some of them, when they finish, they cannot find help. Some of them, this is when, before they even depression comes, some of them even go to isolate themselves. They feel like they are not part of the society. And that's why they get to depression. Now, you are the musician, and you are the doctor and the musician. Yeah. Now, if there is a way, some of the music you produce, you can involve and cut one of the steps, you will be glad for what we're doing for the low vision services. Because we want to make sure, because what we do most of the time, we involve the counselor. The counselor can be a psychologist, the counselor can be a psychiatrist, the counselor can be a social worker that specializes in low vision or blindness, that can prepare this patient. Yes. The job might be more easy for them with the music aspect.
Definitely.
Stuff like that.
Definitely.
But they prepare the patient for us, because if the patient is not ready, and we can want to do a rehab for them, that's not going to happen, because I experienced that with one of the patients. When he came, he's losing his vision. He think his vision can fix 1 to 3 because he did still have his vision. But it was a fight. He doesn't want to accommodate whatever you said to him. He wants to do it his way. because he was not ready. Because when the patient is ready, you pass all this stage, the depression phase pass, you're not die, and now you become in a phase, when you accept your condition, this is when you're going to feel there is hope, and you are ready for treatment. This is most of 99% of people will be able to give their vision back, and these are the type of people. Yeah. We'll be able to get them to be able to drive again, and get them to be able to do the basic living skill, cooking at the house, stuff like that. These are the people.
So now, you cannot really fix a problem if you don't recognize that the problem exists.
Yes.
So, and like you were saying earlier, in terms of the work that social workers or counselors can do with people with disability, particularly in the ophthalmic field or even the vision field. So that's also part of the music for health concept. Okay. How we can not only do disease prevention, health promotion with music, but how we can make people feel better. Because when people feel better about themselves, they have this internal peace that can propel them to do better for themselves. And it's like a circle, You feel better, you do better for yourself, and while you're doing better for yourself, you keep feeling better, and music can do that.
That's good, and I agree with you, and I can't wait for the new album. And I would say to everyone that's watching, Basil is having his CD. He has a few CD out there, and I believe you can get them wherever music store. You can let them know where they can get it.
Yeah, my first album, the title is Sensibilisation. It's a Creole, Haitian Creole word that means raising awareness. And with this album, I basically wanted to raise awareness on health promotion, disease prevention, and also the social and economic situation in my beloved Haiti. The album is currently available on iTunes, on CD Baby. I mean, iTunes I think doesn't exist anymore, but now it's Apple Music. But CD Baby definitely, Spotify, Amazon. So you just need to go online and then order your copy and enjoy some good music for health.
Okay, good. Now, every show has a beginning, an end. But we will be at our last segment. We will be the patient's testimony.
Today, I want to say a few things about the center as far as contribution. Myself, when I came, my vision was better. But as I'm getting older, the vision is getting worse. Now, I end up having low vision. And that's why I'm here at the Low Vision Center. What I want to emphasize for everybody to know, what can we do for the center as far as contribution? This is the end of the year. A lot of people is going to file taxes. Most of us has to return money to IRS. One thing people that don't know, if they contribute, whatever they contribute in a non-profit organization, they can deduct it from their taxes. And Prince Center is one of the places that if you donate anything at the center, at the end of the year, you can deduct that money from your income tax. So I encourage everybody who listen to me now to contribute something, to do something, if they could, to facilitate the center, to help those who are less fortunate, who cannot afford to pay the doctor, to do certain things at the center. So those people can benefit. I encourage everybody who looking at me now to contribute something to help the center. Thank you.
Non pam c'est Margaret Desrosiers. Moi-même, moi j'étais malade en pile dans les yeux. C'est un monde qui était resté pendant que j'ai regardé Haïti première classe. Et puis, moi, ouais, docteur Lucien Prince. Moi, fait expérience, moi, venu la Kaili. Monsieur, ça, docteur, ça, c'est pas seulement le docteur, mais c'est un humain. Curly, c'est pour les malades, les gens qui sont malades dans les yeux. Il ne peut pas apprendre professionnellement pour rien. Il apprend pour aider les autres. Parce que moi-même, des grands pile problèmes comme moi dis nous dans les yeux, c'est lui-même qui sauve grain yeux gauche là. Dieu doit t'attaquer ton prosthétique eye, il te peut être perdu. Dès qu'on n'aime pas ta chambre, moi pas ta chambre lueur pour me même toucher on lettre. Avec docteur Prince l'homme vient une sorte de réconfort, une sorte de réassurance que lui-même lui mettait dans moi-même. Il fait me croire que ma croix et vraiment nous ca dit nous ça expérience là moi pas regret. Docteur Prince là pour communauté haïtienne non parce que son docteur qui vraiment care pour nous. Mes amis, si nous avons famille nous qui malade, pas chita, vini côté li, la ba nous la santé. Pas dire 100% parce que pas bon Dieu. Avec l'aide de Dieu, kembe meni, mon Dieu kembe connaissance li. Docteur ça son bon docteur. Merci, c'est ça seulement pour me dire c'est Margaret Desrosiers.
Well, as I said to you, every show has a beginning, every show has an end. And this is what we have for you. And I don't know if Dr. Basil has the last word to say.
So yes, I have actually a couple of last words. So the first few ones actually, is since we were talking about HIV, I would like to continue to encourage everyone who's working in this field to continue working hard to really make sure that we can meet or achieve the goals that we have, the targets that were established. Of course, by 2020, we will not be able to achieve the 90-90-90 targets. However, those are targets. They sometimes are met, other times they are not. But we need to continue with the fight, with the work, so that we can see improvement in the lives of the people that we are serving, that we are working with. The other thing I would like to also say is that everyone who's working on HIV in my beloved Haiti, I would like to also encourage people to continue that fight. I think Haiti is a little bit far behind in terms of the 90-90-90 targets, but I can confidently and truthfully say that there have been a lot of efforts being made lately in Haiti to really address the HIV epidemic, and that's really well appreciated. So keep on the fight, everyone at the Ministry of Public Health in Haiti, in those different non-governmental organizations. Keep on the work, keep up the work, and because I think we are on the right track. And everyone working in HIV across the globe, because the statistics, when we look at what exactly has been done in, let's say, just 2018, we have seen that the number of new infections for HIV has significantly decreased, and we need to continue doing that to make sure that less people are infected every year, and people who are already infected, they are having access to treatment, and they can live a normal life like everybody else. And the next to last thing that I would like to say is regarding people who are still stigmatizing or discriminating against people living with HIV. HIV is a disease now, like every other disease, sorry. And people who are infected, they didn't choose to get infected. So stigmatizing or discriminating against them, that's not a solution, that's not a way of life, that's not a way to deal with this. HIV goes everywhere. can infect everybody. HIV is in the NBA, it's in Hollywood, it's everywhere in this world. And the last thing that I want to say is that soon I will be having my own show on this network. It's Music for Health. Music in the digit 4 and health, because I strongly believe, like I was saying at the beginning of the show, that music has the capability to not only make people feel better, to impact people's brain, but also can be used as a tool to educate people, to, for instance, what I've been trying to do with music, to do health promotion and disease prevention. And very soon I will be inviting people to join me on this network, and so that I can share some of what I know about music and some of what I know about health, because I think with Music for Health, the concept is about using music to talk about individual health, public health, population health, and the impact of music on the brain. So thank you, Dr. Prince, for having me today. It was a pleasure to be here, and I look forward to the next invitation.
Well, anytime, but most likely you will be inviting me at your show next time. Well, this is what we have for you. We thank Dr. Basil. We thank everyone. We take the time. We know everybody is busy, and whoever that didn't have a chance to watch the show, and they will, when they have a chance. And we thank everyone. And for people that in New York, specifically people that in Long Island, they can also watch the show in channel 115 every Friday from 1 to 3. They can watch both shows, English and Creole. And also people that doesn't have cable, they can watch it. If you have smart TV, you can watch it too. We can watch it, or you can watch it to YouTube. And we thank everyone. This is all we have for you. We'll see you next week.
Monsieur le Président, Monsieur le Président, j'ai une question pour vous. Président, sénateur, tu dis la politique, une question pour nous. Moi, je représente le peuple là. Ok, monsieur. Notre question, monde qui représente le peuple là.
Monsieur Président, ça porté, Monsieur Président, oh, ça nous pas brillant dans, Monsieur Sénateur, ça porté, Monsieur Sénateur. Pas quoi nous c'est quelqu'un, Monsieur Député, ça porté, Monsieur Député. Est-ce qu'on parle suspendre les Monsieur Candidat, ça porté, Monsieur Candidat. Ça pourrait faire pour pays ça fait bien longtemps depuis une campagne d'abtants représentants qui pas vine bonne bon dans seulement qui pas le travail pour faire qu'elle nous content. Ça fait bien longtemps depuis une campagne d'abtants représentants qui pas vine digne pour tant tout temps jusqu'à ce que nous tournions boîte. Monsieur Président, ça porté, Monsieur Président. Est-ce que vous avez fait qu'un content, Monsieur Magistrat? Ça porté, Monsieur Magistrat. Qui ça peut le faire pour villa?
Nous besoin route, nous besoin l'école, nous besoin l'hôpital, mais pas seulement dans la capitale. Nous besoin monde qui pas venir une belle parole. Nous besoin patriote, pas un patrie poche. Nous besoin leader, un bon travailleur. Nous besoin monde qui a parlé à tête claire. Ok, nous prenons note. Dis-nous qui ça nous tourne dans la rien.
Moi tendez yo dit, gasoline dans mon tête. M'entendez yo di, chauffeur camionnette à goumac passager. M'entendez yo di, pas de sécurité. M'entendez yo di, coule 6 heures du soir, tout le monde entre couché.
Nous avons un président qui pas nan rien dedans. Nous avons un sénateur qui pas yon raquette. Nous avons un député qui pas yon crébété. Nous voulons un système qui travaille pour nous. Nous voulons tout grand monde a joué la vie. Nous voulons tout petit monde saute dans la rue. Nous pas voulons personne n'a pété courir.
Monsieur président, ça porté, monsieur président. Est-ce que va faire qu'un content, monsieur magistrat? Ça porté, monsieur magistrat. Ça va faire village.
Did you want to learn more about how vision affects our daily lives? Well, this is a great segment for you because that includes vision in the classroom, women in medicine, and careers for the visually impaired, and much more. Each week, you can be fascinated by topics that include and branch beyond medicine, provided by the PCVI Network. Tune in on Sundays at 3 p.m. on Facebook and YouTube. You can also search PCVI Network and the channel will appear on the search. New and exciting episodes hosted by Drelina and Steve will be posted weekly. You won't want to miss this. Trust me. We'll see you then.